5 years ago, Dr. Vignes was called from his practice down to our emergency room for a routine emergency cabbage. But you know what? This was not a routine emergency cabbage, because when Dr. Vignes cut into his patient, it revealed to him a situation of a heart that had an abnormality that wasn't ever discussed in the literature. And in fact, 20 years prior, his first patient out of med school died with this same condition. What did Dr. Vignes do? He grabbed the computers that were in the OR, and because we had opened up social media in our health system, he was able to immediately find a physician in France who had done that same procedure and had written about it, pulled that information down with pictures, and performed the surgery, and today that man lives. And it's because of social media. 1 month before that, we hadn't made that decision to open up social media. So why is social media important? Social media is important for 3 key reasons. 1, you want to transform the business of healthcare. 2, you want to transform people's lives. And 3, we want to transform the way we even operate in healthcare. So how do we do that? So we transform business because social media is the currency of the new era. Whether we're talking about banking or clinical applications, it's all about social, and it's transforming the way we do business. Secondly, it's about wellness and making things happen on a wellness basis. How do you engage your patients? You're not going to engage your patients in the hospital anymore. You're not going to engage them in the physician practice. You're going to engage them in social. And social is the way that helps bring clinical efficiency and effectiveness into people's lives. And it also enables collaboration. So we use social to collaborate amongst our physicians so that all of them are working together. It's no longer a stovepipe of physicians in one hospital or one practice not communicating, but we use social. In fact, we use social to help reduce the incidence of UTI by 30% in our health system through social media. So it's a way to transform. So what do we need to do? We need to embrace social media. Social media is the future for us. And it's here now. And if you don't embrace it, you can either embrace it and thrive or be disintermediated. That's what you need to know about social media, saving lives, making a difference in the lives of the patients that we serve.
AT&T mHealth engages us in our family's health, like how John's progressing with his fitness program, Emily's immunization records, and managing her allergies, and the latest on our big project. I can see updated readings from this little device through these ingeniously designed apps, and I can share them with my doctor, privately. And security? We control our information and decide who sees it. If we switch apps or even change our doctor, our information goes with us.
Mobile health is an exciting market for developers. The AT&T Developer Center helps us get into it fast. It's a portal to tools and APIs for building apps that run on any carrier's network. It gives us access to data, storage, and hosting that are designed to meet HIPAA standards. We can piggyback on the relationships AT&T has forged with device manufacturers, data providers, and the health industry to design apps that link information from the silos it's been sitting in. And that inspires creative developers like us.
For healthcare enterprises, secure network communication and reliable data integration is what mHealth is all about.
This is Jennifer, and this is her son Ben. They just started their long-awaited and well-deserved family vacation in Florida. Shortly after arriving at their hotel, however, Ben started to experience ear pain that threatened to ruin their beach day. A sick kid in a city Jennifer didn't know panicked her at first, but thankfully, she remembered she had iTriage on her smartphone. On the fly, iTriage helped Jennifer quickly and accurately answer all her questions. What could be wrong with Ben? Is it serious? Should I take him to a doctor tomorrow or find care now? Where is the closest hospital or clinic? With a little research and the knowledge that Ben has been at the pool all summer, Jennifer uses iTriage to ID a probable case of swimmer's ear. It recommended she skip the costly ER visit and steered her to the nearest open urgent care with turn-by-turn directions. Jennifer zipped through all the waiting room paperwork hassles by advanced registering and making an appointment right from iTriage, and she and Ben were greeted by name by a staff who were ready to help them. Pretty awesome. Jennifer shares Ben's medical history and current medications, which help their doctor prescribe the perfect antibiotic. Thanks to iTriage, Ben's earache is a thing of the past, and he and Jennifer are back to having a time of their lives. iTriage makes navigating your healthcare easy, wherever you are. It's your healthcare simplified.
Joseph Mayer. I'm the CEO and co-founder of Curator, which I actually began about a year and a half ago while I was a resident at Mount Sinai Hospital right here in New York City. Curator is a HIPAA-secure mobile text messaging app and workflow navigation solution that includes lab alerts, event notifications, shared task management that providers can use at the point of care to communicate with all members of the care team and make the right decisions with the right information at the right time.
We believe technology should make our lives better, and nowhere is that more important than when it comes to our health. Just imagine what we could do if we knew where illness was spreading in our local community before it affected our friends and family. Individuals could take action to avoid getting ill. Parents would know at their child's first sign or symptom how to respond. Physicians would better care for patients, and society would finally have the tool it needs to track and stop the spread of illness. At Kinsa, we're applying design and technology to give you that information. I started Kinsa after 5 years running part of the Clinton Foundation's International Health Program. I will always be proud of the work there, but I was struck by how little we knew about where and when disease was spreading. Together we assembled a dream team and thought carefully about how to gather this information. Because fever is often the first sign of an illness, it allows us to know right when someone is first feeling sick, before they've even visited the doctor. The solution will sound simple, and it is, but we think it's the basis of a revolution in health. It starts with a device that's probably already in your home. We've just made it simpler and smarter by connecting it to your phone. This is the world's smartest thermometer. It tells you how to avoid getting ill or get better faster if you are. We've designed the Kinsa Smart Thermometer to be faster and more accurate.
My 5-year-old Nathan isn't feeling well, so I'm going to take his temperature.
By using the power of your smartphone, we've minimized the electronics inside. There are no batteries, processor, or LCD. This allows it to be thin, flexible, and comfortable to use, especially for children.
Reading complete. Nathan's temperature's okay, but he's been complaining of a sore throat. With a few simple taps, I can track his symptoms over time and share them with our pediatrician. And since he probably got sick from one of his friends, I'm checking the health of his school to see what he might have. Here I can see the private group that I joined with other parents from Nathan's class. 5 out of 24 kids are sick and strep throat is going around. Though he doesn't have a fever, I'm a bit nervous, so I look for the nearest urgent care facility with an opening.
To make sure that you have everything you need to keep your family healthy, we're adding features like one-touch call nurse and an illness forecast so you know when you're contagious and when you're likely to get better. Even if you haven't joined a private group, you can still check your local health situation. Here it is on a map. We combine our data with data from others to give you what we like to call the health weather. You can see the contagiousness level and what illnesses or symptoms are circulating in real time. But Kinsa is about more than just a thermometer. It's about an idea that our health is linked directly to the health of those around us. Your support will start a movement. Join us, and together let's revolutionize health.